National Health Authority CEO Dr. R.S. Sharma ji, Additional CEO of National Health Dr. Praveen Gedam ji, NASSCOM's President Devjani Ghosh, our ACS Health and Forest Shri Javed Akhtar ji, Mr. G.V. Ahmad, and our Commissioner and this missions director from Karnataka, Randeep ji, and all distinguished guests on the dais and off the dais, friends from the media. This is a great conclave, very timely. The association of NHA with NASSCOM. Today, all the speakers before me have made my job easier by saying all the technical details of this platform. And I really congratulate the great work by NHA especially, and special thanks and appreciation to Dr. R.S. Sharma, under whose leadership this Ayushman Bharat digital mission has envisaged and which has become a reality today. The Western world is still in a kind of pleasant shock about the progress that Indians and India has made, especially in IT space, technology, and human sciences. And this conclave has been held in Bangalore. Bangalore being the IT hub of India, known as Garden City, and a city also for technology startups. I was just told there are about 7,400 startup companies only in the health sector. So that is the kind of ecosystem that's there in Bangalore. So Ayushman Bharat, the name itself indicates, why do we have to create all this technology? Why do we have to do these kind of lot of apps that we have done? Our Prime Minister, our Honorable Prime Minister's wish is to ensure that this country offers access, affordable, and equitable healthcare to one and all. Ayushman Bharat means that the long life Indians. This can only be a reality when we ensure that healthcare is provided, the quality healthcare, in fact, is provided to one and all across 1.3 billion people. So it is not only possible by providing the infrastructure, as our ACS was mentioning, it is not only the supply and distribution, it has to be supported by the kind of technology that we are all trying to achieve, we are trying to build. So today the technology platforms, especially in the field of healthcare, has provided a great arm of ammunition for a healthcare professional to provide and to give the best healthcare to the last person of the society. And this is the dream of our Honorable Prime Minister, Digital India. We have done that using Aadhaar few years ago. Today, Aadhaar has helped us to ensure that distribution of all our schemes, subsidies, reach every beneficiary of this country. Similarly, UPI. And today, Ayushman Bharat Digital Mission is going to be the largest platform I know that it's going to be in the world for the healthcare. So today, this program, it's going to change the face of healthcare of this country, and it is a revolutionary in nature. So ABDM, it aims to bridge the gaps that are there in the healthcare and create a holistic and integrated health platform for the entire country. So how do we do that? There are 4 important aspects to this. As Mr. Gedam has already briefed, I will be very brief in saying this. A unique health ID, ABA, Ayushman Bharat Health Account, is the first and foremost thing that we have to ensure that it is integrated. Similarly, the registry of the healthcare personnel. Right now, some private hospitals and corporate hospitals may have it, the data of the healthcare professionals. We need to ensure that we collate the data of all the professionals, healthcare professionals, from super specialist to the last healthcare professional available in the space, and it has to be digitized. Similarly, all the facilities, right from dispensary or a mobile healthcare unit, mobile vans, PHCs, CHCs, taluk hospitals, all clinics. So this kind of digitalization can revolutionize the process, and it can really support the ABDM network. So much so as to even it can completely take away the role of even quacks. Quacks can also be eliminated in the process. Today, that is also a challenge that we are facing in the healthcare department. And this era, that I can say that it is a post-COVID era, optimistically I would like to sound. So in this post-COVID era, we need to build the networks using technology to support not just the from what we are preventive medicine to the promotive medicine. We need to move on to the predictive medicine. Recently, I had met an envoy from Estonia, a small country in Europe. She was telling me, when an ambulance goes to a patient, they know exactly what is the kind of blood group that patient, and they take that blood also along with them. And also I know in Israel, their e-registry is so well advanced For a fact, they know that if some person can have an occurrence of MI few days before, they will predict and they will go to that person based on the history, based on the data that they have. And they go to that person, they'll request him to go to the hospital and do all complete diagnosis. This will ensure that that person will not, even if he is prone to the MI, he will definitely be prevented by the occurrence of MI and save so many lives. So that should be the forward path of technology and the digital world. So as a Karnataka health minister, I would like to say a few things which I think ACS has covered most of the issues. Karnataka has always been a pioneer in adapting and introducing a lot of technology to support the healthcare services in the state. That is one aspect which he has not mentioned. I would like to take only those aspects which he has not covered. E-Manas. E-Manas, we are using the technology to reach out and to promote the mental health of this state. This we observed especially during COVID times. I still remember the first incidents when somebody just after hearing that initial days, I'm talking about the first phase of COVID, he was admitted in our Victoria Hospital in Bangalore. Once he came to know that he is tested positive, he could not take that shock, or he thought that he would die. And he subjected himself for the suicide in the bathroom. So that is when I decided, that time our ACS was there, we should create a platform. We should arrange for tele-counseling using our NIMAN, state-of-the-art mental health institution that we have in this country. Luckily, we have it in Bangalore. So I spoke to Director Dr. Gangadhar then, and he very happily partnered with the government of Karnataka using the digital forum platform of the RGHS, Rajiv Gandhi Health University. And we catered to more than 25 lakh COVID infected patients. So we did counseling for 25 lakh and odd patients. And similarly, this E-Manas, as a pilot project, we have taken in 3 districts of the state. And I'm very happy to say that the government of India has really liked this initiative, and they are rolling out this initiative for the entire country as a national digital health mission program. So similarly, tele-ICU was also started during COVID days, because I wanted to ensure the same uniform health protocol, treatment protocol is given to even the patients who were in Bidar, who were in Raichur. So we also had the same uniform protocol, treatment protocols, right from Bangalore's, the corporate, one of the best corporate hospitals. What we practiced there, what we treated, what the treatment was given to the patients here, we ensured that the same quality of treatment was given to Bidar, the patients who were treated in Bidar or Raichur, aspirational districts of the Karnataka, using tele-ICU technique. This was the first time we used, and I thank the corporate hospitals like our Dr. Jairam is there. He was heading the Columbia Asia then, Manipal Hospital. Both very happily, they partnered with the government. We had 2 shifts round the clock. For several months, they participated, they partnered with the government, and they catered this service free of cost. So why I say this, the role of private sector is paramount. Because in this country, 50% of the healthcare or more, maybe the healthcare services are catered by the private establishments. So we need to partner with the private establishments, private sector. So this digital mission, in this platform, we need to take the data from them. There are a lot of hospitals which are taking data, but not sharing with the government. But this ABDM will definitely help us to collect all the data which is already there with the private establishments today. Because e-registry or the tele-registry, health registry will help us to identify the problems, not just to identify the problems, to design the programs to really ensure that we mitigate a lot of infections, be it contagious, non-contagious. So we are giving a lot of onus on NCDs also. In fact, we have almost surveyed more than 6 crore people in the state for NCDs today. So we know how many people are suffering from hypertension, how many people are suffering from diabetes. We were always focused on the contagious diseases. Today, NCDs are more concerned than the communicable disease. Because out of the all deaths, more than 20 to 23% of deaths occur because of the NCDs. So this data collection is very important. Because most of the time, people are confused. They don't know which doctor they should go to, which hospitals they need to go to. And especially in emergencies, if somebody has to go based on the referral system, once they go to a super specialty hospitals, then they have to give all their records again, or they will ask them to give their blood samples again. So you will save the time if there is this kind of a digital platform with the data which is available from village to the international capitals. That becomes easier for the doctors and the patients. That is how you can save a lot of lives, timely lives. So our Honorable Prime Minister has envisioned and has laid a great emphasis to ensure every Indian gets this kind of a quality healthcare. We all know that Ayushman Bharat, Pradhan Mantri Jan Arogya Yojana is one of the largest schemes in the world today, catering to almost 50 crore Indians, offering every Indian family 5 lakh rupees for their treatment cost every year. And once this ABRK card is available to an Indian, it is permanent. There is no renewal. There is no money that need to be paid as to the insurances. We have seen in US, we have seen in Europe, what is the cost of the premiums there, health premiums there. Today, even that card, recently in the Shibir that we had in Gujarat, our Union Health Minister decided to offer the digital card, the smart card, ABRK card, free of cost to the all Indians. Even that card, we don't charge. So this is new India under our Honorable Prime Minister Shri Narendra Modi ji. Regarding tele-ICU, as I said, from 49% of ICU mortality, which we saw during the first wave of COVID, it dropped to almost 27%. So that was the advantage of tele-ICU. Similarly, telemedicine, teleradiology. Teleradiology, I think we have done almost 7,000 X-rays which have been reported till date. And it is only 20 minutes is the turnaround time. E-Sanjeevani, there are 2 modules. One is OPD and another one is teleconsultations, where we stand number 2 after Andhra Pradesh. 52 lakh teleconsultations have been taken place. And in OPD module, there are about 24 lakh teleconsultations. We would have been the first. But as ACS said, we had several apps, several platforms. During COVID times, we partnered with a NGO, Step 1, and we catered almost 25 to 30 lakh teleconsultations on that platform. So this was not added in this E-Sanjeevani, so we stand number 2. So always use of one portal is always good for a state. So we have realized that. Regarding CoWIN app, as Sharma ji was mentioning, I really acknowledge, I feel very proud to say that India is the country that we gave digital slips for our vaccinations using CoWIN portals. In advanced country like US, even today they're issuing only manual slips, manual receipts. So this is the new India that we are all in. We should all be proud of. We should be proud of our officers like Sharma ji, who has really done this in 10 days. In 10 days, developing an app like CoWIN is not easy at all. So in Karnataka, we are also replacing our obsolete ambulance system. Today, we are trying to use basic technology systems like GPRS2. We are mapping all health facilities in the state that is available, so that the pilot and the person who sits in the call center, based on the call center's advice and suggestion, the pilot can take the particular patient to a particular facility depending on his condition, depending on the kind of service that he requires. So this also, I think, will be rolling in a month's time. E-Manas, I should also thank not just NIMANS and Triple IT also, which has partnered with us. So we have also nominated our commissioner, as I said, to roll out this ABDM in a mission mode, because always our Prime Minister believes in the mission mode. Speed, escalating, scaling up, and reaching out to the maximum number of people in a short time. So this is the mantra of our Prime Minister, and this is exactly what Karnataka would like to be leading from front, and we would like to do everything possible to support NHA on this. Lastly, intersectionality of industry, government, and academia is much needed today for holistic growth, and we would like to encourage that. So NASSCOM, this body being IT stakeholders, also the IT giant Bill Gates himself has praised this digital network, ABDM. He has also said that it will help ensure equitable, accessible healthcare delivery and accelerates progress on India's health goals. So there is a proactive leadership at the state. Our Honorable Chief Minister Shri Basuraj Bommai, and there is a proactive leader in our Prime Minister Shri Narendra Modi ji. So there is a double engine governments at the state and government. So center, we are utilizing, we are going to seek all necessary help, the guidance from the government of India to ensure we provide the quality health care to all our citizens of the Karnataka. So revolutionizing India's digital health is very relevant in today's world. And this will help in promoting knowledge sharing, forge innovations, and build partnerships and accelerate the integrated health ecosystems in India. I wish this conclave a very grand success. Thank you for the opportunity to address all of you. And I thank all the young entrepreneurs from the technology who have also come here and shown interest to partner and to guide the future healthcare. So thank you once again to all of you.